So the US Physician Paradigm Study was conducted to look at the trends in the physician prescribing of frontline systemic therapies for metastatic urothelial cancer patients. Unfortunately, a majority of patients do not receive second-line therapy when they have metastatic urothelial cancer, and we wanted to understand how these trends have changed over time and what are the prescribing patterns for frontline platinum-based chemotherapy, as well as the maintenance immunotherapy that is now approved by the FDA. So basically, what we did is we did a targeted literature search and qualitative interviews and a cross-sectional survey of U.S. medical oncologists as well as urologists to understand these treatment patterns. And this was primarily, we asked what treatments they utilize, whether they are using the immunotherapy Avelumab that is now approved as based on level 1 evidence after platinum-based chemotherapy if patients do not progress. So basically, we first did the literature search between January 2018 and March 2021, and 60-minute qualitative interviews were conducted with medical oncologists and urologists, in which 150 providers participated. And we also asked questions whether what kind of practice they were in, a private practice or a large group practice or academic practice, etc., and how many years they've been in practice. And we found that the respondents were 8 respondents were community oncologists, 4 were academic, and 3 were community urologists. And these were the folks selected for the qualitative interviews. And all the physicians estimated that over 75% of the patients were receiving systemic treatment in their practice. And they also reported that the patients receiving systemic therapy, the utilization has gone up in the recent years, given the availability of immunotherapy and other agents. And the most common reason why patients were not treated with systemic therapy was cited to be poor performance status and patient preference, comorbidities, frailty, and old age. But poor performance status was the most common one. And platinum-based chemotherapy followed by immunotherapy maintenance with Avelumab was the regimen of choice based on this interview. And single-agent immunotherapy was utilized for patients who were not eligible to receive carboplatin or who refused chemotherapy altogether. And it appears that majority of patients, up to 80%, were offered second-line therapy also based from this survey. And the top 5 physician-reported reasons for not prescribing any frontline therapy was poor performance status, patient refusal, advanced stage, concerns about tolerability, and social factors like caregiver support, etc. And basically, we learned from this study that this was the uptake was higher than what has been reported in the literature, and that is really encouraging. And the results, obviously, there's limitations of such surveys. We can't generalize to large samples since this was small. However, we are, doing a larger study of quantitative surveys and looking at these patterns more carefully.